Mr. President, we are very honored as the editor of the Look in Medicine Review to organize a publication dedicated to Vivacy and particularly to the development of hyaluronic acid, which is at the heart of industrial research and the development of hyaluronic acid applications. Could you tell us a bit about where Vivacy's development currently stands in this sector? First of all, Mr. Benamou,
I thank you for reaching out to us to create this type of document, because it's true that very few media outlets talk about hyaluronic acid as a medical device. We see a lot of communication in the press, in the media, about hyaluronic acid in general, but it's very rare to talk about this molecule, which is a fantastic molecule used in many fields now, and that we have been using in our hyaluronic acid gels for 18 years, which was the creation of Vivacy. But indeed, as a medical device product, in any case, this is one of the first times we see a document created for all of these.
We have devices. So it seems that indeed even the general public knows about hyaluronic acid today, because in cosmetology, hyaluronic acid is used to make a cream appear with an anti-aging effect. Can we go further in understanding this molecule, because it seems to be derived from relatively old research? We will discuss it in the review, since it dates back to the years of Karl Mayer's journal with a certain German biochemist named Karl Mayer. But since then, 120 years later, where do we stand on the knowledge of this molecule?
So this molecule itself has evolved little, because hyaluronic acid, we all know, is a component found in the human body, which is natural. In fact, it's the way we extracted this molecule to then transform it for cosmetics or hyaluronic acid gels used in medicine. And in fact, this molecule is still the same. It's a well-known polysaccharide among chemists. However, it's the way we work with this molecule. It can be shaped to allow for gels with different rheologies that will adapt to the tissue subsequently. What happened, in fact, is that at some point after the discovery of this molecule, actually there was a period of industrial development. And it's true that largely everything started with ophthalmology, actually. It's a gel that was used for eye surgery, cataract, and that, in fact, gradually we developed other indications with other formulations and directed actually our developments, particularly in aesthetics, but also in rheumatology, and now also in gynecology. So there you have it. It's a molecule, in fact, that evolves based on the industry and its technologies, actually, towards new therapeutic goals.
Absolutely. So what you're saying about the initial interest in gel for cataract surgery, actually, it's quite amusing, because the discovery of hyaluronic acid was made in the vitreous humor of the eye by this German biochemist. And so initially, indeed, it was from the eye tissue extracts that this molecule was discovered. And then, on the applications we will discuss again, particularly in rheumatology, another Hungarian biochemist, Balázs, apparently had, but it was in the 40s, so it's relatively old, was convinced that this product could be used for treatment. At the time, he was talking about knee arthritis. Today, we are rather talking about knee osteoarthritis, which is the deterioration of the cartilage. How this eventually became a reality in the pharmaceutical industry.
Well, it didn't happen by chance, because in fact, there was already a demand and a need in ophthalmology for cataract surgery to have a gel that could be in fact injected into the eye to work during cataract surgery, to be able to insert the instruments and place the implant in the capsular bag. So a lot of work has been done on this. At the time, the rooster comb was widely used, the extraction based on rooster comb. It is therefore a technology that we reused later on. In a company that was Cornéal in France, where at the time Cornéal had agreements with farmers actually from Bourg-en-Bresse, and actually we had roosters, and so we did extractions. We froze these rooster combs and did extractions of diuronic acid at the time in this company. We had a butcher, by the way, who did the extraction and all that. We were completely self-sufficient. And then the avian flu arrived, unfortunately, and that's when we, in fact, developed this biosynthetic diuronic acid, actually in quotes. It's based on bacterial fermentation, which is today the most used technology in the world. The Streptococcus capsules, that's it, which is the most used in the world because technologically also it was accessible. That is to say, because like all technology, producing a kilo but producing a ton, there is a fundamental difference. And this is where all the ingenuity, in fact, of recent technologies for extracting diuronic acid, the raw material, has actually emerged. What also happened is that the manufacturers of diuronic acid gels, especially during the corneal era, where we were indeed the pioneers in monophasic diuronic acid of the time, also had this originality, which is to create, thanks to this raw material, in fact, gels that were, as the name suggests, monophasic, thus homogeneous gels with this homogeneity that meant, in fact, the products initially spread very well on the skin, but on the other hand, these technologies have also evolved over time because the first gels we made, they were difficult to inject. And then, gradually, we continued this research to improve it, improve the process, improve the production process, and we moved on to bicross-linking. Is that right? Absolutely not, no. There were two technologies, monophasic and biphasic. Biphasic was the original technology of Qmed, in fact, which at the time had a patent on this technology, but we somewhat revolutionized the market by creating a monophasic product, meaning it was a different technology. And there you have it, and then afterwards, when we created Vivacy, we developed a technology at that time, at the time of creating the first generation of monophasic products for aesthetics. And then we created a new generation, and this is where the originality of our technology lies, and it's that it was able to assemble uronic acid matrices one within the other. That is to say, in fact, we create a mechanical elasticity, actually. And this is what we call IPN technology. In fact, IPN is a technology known in the world of chemistry, actually, where molecules are associated one within the other. And in fact, what we managed to do, starting from the base of monophasic uranic acid technologies, is to assemble these molecules into each other and also these matrices. And what has resulted, what has actually given the product a lot of elasticity, is what makes our product strong today.
Elasticity provides a kind of filling, giving a volumizing effect. When the gel is injected, it occupies space. For example, in place of a wrinkle, it will fill the wrinkle. So where does it lead to something else? Well, for us,
what are the mechanisms? The entire thought process at the product design stage, we didn't think about injecting into a wrinkle. In fact, we thought differently. That is to say, we conducted a rheology to inject into a plane. So depending on the layer into which the product is injected, that was the whole thought process, because it's true that before this we used to inject a wrinkle. And then we moved into a different strategy, actually, therapeutic, with the goal of creating volume in the face. And so it was a different approach. And that's why when we developed this EPN technology and discussed with many doctors, especially at the time when injection techniques were emerging, which were similar to lipofulline that was used, but actually in the face with microcannulas as well, also advanced hyaluronic acid technologies. And for that, it was necessary to be able to have products with enough, as you say, elasticity so that they spread well at a given moment, but also create, with certain rheologies, the ability to create volume in the fat compartments. So it's this entire therapeutic, holistic vision.
Actually holistic.
That has been developed through the formulations.
It's actually chemical bioengineering that has been used to better understand and adapt to the doctor's demands.
Yes, that's right. We completely responded to the doctor's demands, somewhat preemptively, because at the time the iconym was just starting. But in any case, we, in terms of the vision we also had in relation to what we had done previously, we wanted to go a little further in the therapeutic approach, if I should speak of therapeutics in the field of aesthetics.
Yes.
But in any case, I think that...
Because it's therapeutic, there's no doubt, as a surgeon, I can affirm that it is a response to a genuine health demand, and therefore it's a real treatment.
There is both the creation of volume, but there is also the aspect of revitalization, hydration, which...
Hydration is a key word in hyaluronic acid. This extraordinary hydration power, a viscous molecule, but one that ultimately has the ability to attract water.
Is the very nature of hyaluronic acid, in fact. If we take basic hyaluronic acid, it's like a sponge that absorbs water and an exceptional quality. Exactly. This is the nature of hyaluronic acid. Afterward, we formulate it in such a way that this product, once again, this gel, positions itself in the tissues, both spreading out and creating volume, but also when you talk about this hydration, it's an effect that is the natural effect of the molecule from the start.
So the use in other indications than, let's say, the needs of aesthetic medicine and surgery, outside of aesthetic dermatology, has there been talk of its potential interest for osteoarthritis or for joints, since a product that is naturally inside the synovial fluid in the joints, when these joints suffer, it probably lacks a kind of lubricant, a product that will ultimately be a substitute or assistance with the relubrication of the
particulations. So the high indications of aesthetics, it's true that gonarthrosis, indeed like coxarthrosis actually, after the products in this field existed before aesthetics, by the way, it's a product that has been around for a very long time. We have had proof of their effectiveness through a number of studies. Then, what we have noticed lately, initially, very focused at the time on people of a certain age with arthroses. Then it depends on the level of arthrosis in people. But we realize today that this type of gel is actually used for young athletes or older athletes. I'm not sure how to put it, but in any case, it is now a therapy that has become very mastered and especially used for a large number of people. In fact, compared to 20 years ago, we used to inject really elderly people. And that's why I'm leaning a bit towards this medicine, because it feels like these products have been around for a very long time, so with rather old indications in quotes, but that's not the case at all, because we realize that the population is also getting younger. Athletes, when we talk about athletes, everyone is encouraged to play sports. So inevitably, when you play sports, there is wear and tear.
We wear out the joints.
These markets are also growing significantly, and there is a demand. And this demand, it is precisely linked to these pathologies, which are unfortunately pathologies of wear and tear over time, both joints and then, because in fact, People want to stay fit for a long time too.
Mr. President, you still have many sectors that are under development. You mentioned gynecology with a product that many colleagues are familiar with and which is used particularly in what are called postmenopausal syndromes after breast cancer, with hormonal treatments that lead to vaginal dryness, with urinary disorders, very difficult for women to endure. So, can we today, with products from Vivacy, better treat this kind of problem?
It's simple. Until now, there was nothing. And in fact, we have developed a uronic acid gel that is intended to moisturize the anterior third of the vagina. In fact, all issues of pain, post-cancer, post-menopause, are issues that are indicators for these uronic acid gel injections. It must be acknowledged that today it remains a very small market because it is little known, insufficiently known. It is changing tremendously. Until recently, no one talked about it because it was very taboo, in fact. And we also noticed that during visits to gynecologists, they spoke very little about it, meaning that, unfortunately, women who have this type of discomfort, in fact painful, which are everyday discomforts or discomforts during sexual intercourse, in fact, are hidden issues, and little by little we see that over time. So it's true that this product has been on the market for 7-8 years, but we see that we were somewhat pioneers in this market. But in any case, it's a solution that works perfectly, providing quick results, and above all, it's an injection that takes 10 minutes at the...
Moreover, with Luca Medicine, we have produced, thanks to you at Vivacy, a special issue for the last Pink October on this particular theme. And so, this issue, by the way, was published at the European Parliament with the help of the French Society of Obstetric Gynecology. So this means that awareness is being raised. It means that the laboratory's efforts, which span 7-8 years, require tenacity to withstand the difficulty of introducing innovations.
Gynecologists, you have to be tenacious, yes, indeed, but I'm not alone. There are research teams, there are marketing teams, and that's why. And then there are the pioneers, there are those who think, and then those who execute. And it's always the same, and it's true that there are visionaries, and I have a particular visionary who is Valdemar Kita, who is, in a way, who also motivated us through his developments, because there is also contact with the doctors, because it's them, actually, in a way, we know how to manufacture the products, we know how to develop them, we know what type of gel would be needed for an indication. And it's true that we have a team dedicated to that, but we will never know how to inject the products. So that's why synergy with doctors is essential, meaning we want to make products that are of quality, that comply with regulations, and that are used under good conditions by doctors, and above all, that patients benefit from them, because there is both the physical or sensory benefit, but there is also the psychological benefit, which is very important, because what we've been talking about all along, aesthetics, rheumatology, pain, intimate discomfort, all of these are sufferings. And somewhere, if we must talk about contributions in terms of public health, I find that we don't talk about it enough. Because immediately aesthetics, we talk about aesthetics as if we don't talk. Often people don't know the world of aesthetics well either. We talk about it like a luxury. It's not necessarily
it's not a luxury.
It's not a luxury. when we talk about rheumatology issues, osteoarthritis, it's the same. It's not just related to age itself, and that's why I return to this psychological aspect, which is very important, because somewhere the objective, it's not to do good to people, it's mainly to provide solutions that will bring them comfort in their daily lives.
Excellent. Mr. President, perhaps to conclude this fascinating interview, is it in the next 20 years with hyaluronic acid and Vivacy, how do you see the projection of the company that started with a lot of faith in what you do? You have created a Vivacy Academy. Does that mean that indeed better awareness of the right indications, the right ways to do things?
Today we have talked a lot about hyaluronic acid. Its molecule, its indications, the gels as well, without going into too much detail, but in any case we have talked a lot. Afterwards, for Vivacy, the future is still hyaluronic acid. It's about manufacturing gels, continuing to develop formulations for other indications in the body, human, particularly the creation of space. Potentially a lot can be done with hyaluronic acid gels. It's not just the field we talked about today, there's also the entire field of oncology, which is an area we can work on. However, our gels will never treat cancer, but they can certainly be used during therapies to create spaces, specifically to protect peripheral spaces during treatment. So there are things like that. Looking ahead, the future lies in the fields we've mentioned, like aesthetics, because aesthetics is a market, and all these markets have high potential and will continue to grow. So the demand will continue to be very strong. Therefore, the future for Vivacy is to keep producing hyaluronic acid gels. Hyaluronic acid gels, but also to certainly develop other technologies that will further enhance the power of hyaluronic acid, of its molecule, this molecule, which is a fragile one, hyaluronic acid itself. So that's why if we want long-term results, in a way, it needs to be a molecule that is somewhat, to keep it simple, stabilized over time. And that's why it's important actually to tell the general public that our technologies, which are French technologies, I would like to clarify, however, because there are very few French companies left in the world.
As well.
We have had French expertise for many years now, and hoping that in 40 years' time we'll still be here. And then we'll be here in any case with innovations, with our teams once again to meet the doctor's demands.
Thank you very much. We are delighted with this moment. And then we will develop in the special issue of the journal everything that has been somewhat presented, the different gels, the ways to make them, the rheology of the gels, etc., etc. So it will be an exciting issue. And thanks to your support, we hope to better promote this molecule, on the one hand, to doctors, to surgeons, but also to the general public. And to the public authorities, it can be important too. Absolutely. Thank you, Mr. Blayman. Thank you. Thank you very much.